hotels and the innovations that happen at these sites because of the pandemic and because there was some space within the emergency to try things in a new way. And we also heard how things are still changing and still shifting. And so what we have been doing as this project has been brought to different neighborhoods of LA County is to talk to people who know about this area and who are the experts who are doing this important work of being in the field and changing these systems and working within and around and through. So I'm going to introduce the panel that we have here today. I don't have all of your job titles memorized. So I have with me Amber Sheikh, who is a LAHSA Commissioner and Community Advocate. I have Dr. Caleb Lusk, who is the Chief Medical Officer at the Harbor Community Health Centers. I have Valles, who is a crisis intervention specialist at Long Beach Department of Health and Human Services. And I have Jetzel Chavez, who is the Domestic Violence Regional Coordinator of SPA 8 for Rainbow Services. And just to say, we are in SPA 8 right now. Los Angeles County divides everything up by service planning areas, which is also how we have been dividing up our tour of Los Angeles County. So why don't we just start out by having each of you talk a little bit about what you do in a little more depth, and if you want to share something about how you got into doing what you do right now. Amber, do you want to start?
Sure. I should use this, yes?
I think so, yeah.
Pretty loud. By the way, there are so many other folks here that could easily be sitting here. So many of you do so much work in this region and field. So I actually started working in homeless services close to 20 years ago on Skid Row with women, and then worked, so basically I have a professional background in homeless services, which has turned into an advocacy background, and I find that to actually be my most important role, is as a community advocate and translator for our communities to understand what is behind homelessness, what are the solutions, and how humans can actually connect with other humans and help us move through this crisis in a very one at a time, one by one human way. I also obviously spend time in our systems work as well, but I don't find that to be my most interesting role, to be honest. Not that I don't love being part of the bureaucracy, but I find that at the end of the day, people hear the lovely humans that spent their time on stage and sharing their stories themselves with us, like that's my jam. So that's why I'm here, whereas we have more professional people here. Dr. Lusk, who is one of my local heroes, is next.
All right, so yeah, I'm Caleb. I'm a family medicine physician and addiction medicine doctor. So I love that. Thank you so much for putting on that show. It was amazing. I actually got my start at the COVID hotel.
Oh, wow.
Yeah. So it definitely changed the way I show up, and the way I do my work. So I was a resident physician in Riverside, California. I met Jen, and she had a position. I was a moonlighting physician at the COVID hotel, and I was at 354 South Figueroa Vagabond Inn.
Yeah.
And
that was a place.
it was everything you said it was. That was a perfect picture of how it went down, and it really did change my trajectory of where and how I was going to practice medicine. It ended up really kind of guiding me into doing addiction medicine and really wanting to come to an area where I could do that work in a patient-centered medical home and provide as many of these services as we can to folks in the area. And yeah, I was just really happy to be a part of that journey, and it was just a special time, and yeah, and I'm just passing that on, and being a do-gooder, like I was taught to do at the Vagabond Inn.
Thank you.
My name is Val. I am a crisis intervention specialist with the City of Long Beach. I got my start in the field actually as an addiction specialist with Project 180. Prior to that, I was a caseworker with one of the rehab facilities in Pasadena, which is where I'm from actually, and still live. So I worked as an addiction specialist, case manager, substance use case manager on Skid Row, the people concerned, and then I got this job because the Community Crisis Response Team is a pilot program for the City of Long Beach. We're a little over 2 years in. We field calls from emergency communications, and we're alternative to police, basically. We're not really alternative to police, but we handle calls. We work with the health department. We spend more time with community members than would normally happen, and we have transportation to sites. We take people to safe landing as often as we can. They have to be willing, of course, because we are not forced treatment, and there has to be a bed available. So we have done that quite a few times. We spend, sometimes hours in the field with people to make them feel comfortable, not rushed. Again, we're not forced treatment, and our team consists of a crisis intervention specialist, which is me. We have a public health nurse, a peer navigator, our supervisor is a clinical psychologist, and our program director does the admin and most of the updates on the team. So, yeah.
Good evening, everybody. Thank you so much for having me here, and thank you so much for your performance. My name is Jetzel Chavez. I am the Domestic Violence Regional Coordinator for this area, Spot 8, and I am housed at Rainbow Services. So my role, a little bit more, I don't come from the traditional homeless background. I've worked with survivors who have been on the streets, but not, this is a completely new field for me. So I used to work, so my role currently, I am working at the intersection of victimization and homelessness. And that victimization includes domestic violence, sexual assault, and human trafficking. Oftentimes, those are the intersections that coexist, and domestic violence is one of the leading causes for women and children who are out on the street. So I work with different regional coordinators who are also across LA County in different areas, housed at homeless services or victim service agencies. I've worked, like I mentioned, I come from a little bit of a different background. I've worked at 24-hour hotlines, I've worked at shelters, I've worked at a family justice center in downtown LA. I've also done work with overseeing a domestic abuse crisis response team where we would go out on the streets whenever there came a 911 call for law enforcement for survivors who were seeking services. So I have been in the front with survivors, and that is, like I mentioned, a little bit more different than these other folks here. At this current role, I work closely with LAHSA's domestic violence unit, so we can coordinate services, make sure that survivors are accessing the resources that they need when they're experiencing homelessness to become stabilized, as well as more of a systemic level, making sure and advocating for policies that will influence survivors as well as funding advocacy.
Thank you so much for all the work that you do, all of you. So I'm going to ask you each a specific question about some of your work because I want to dig a little bit deeper into what's happening around here. So Caleb, I'm going to start with you because you were at the Vagabond, and I'm wondering if you could talk a little bit about what you saw at the Vagabond that has influenced your work now and what you're doing in addiction medicine right now.
Thanks, yeah, so what influence? I think it was a scary period when when COVID was just starting, and that's when Vagabond got going, and it was scary. It was raw. We didn't really know what we were doing, but we had a mission together. And I think what I got most out of it was just the collaboration with the team. Like that was the best part, and the patience too. But the operations team, getting the food, getting the medical supplies, getting it in there. Nobody had an ego. And it's rare in a hospital setting. Like, there's a lot of egos around in a hospital setting. Physicians, nurses, everybody, but everybody had a mission. Everybody put their ego aside and just worked to do what was good for the patients. And just the way that the care was provided is really, it was natural. It was natural. It was compassionate. It was empathy. It was just people there helping other people. And that just really changed my perspective on healthcare. That's where I prescribed my first Suboxone dose, which is a medication to help with opioid withdrawal and management. And that was the first time I prescribed that, and really had a couple good mentors there, and that really made me want to go into addiction medicine. And then I'm a National Health Service Corps scholar, so I needed to come back to an area and work in a federally qualified health center. So I'm right down the street at Harbor Community Health Centers.
Yes.
So I've been there for about 3 years and took all of the things I learned at Vagabond and we're trying to implement it at Harbor. So, bringing that case management, social work, mental health, all in one roof. And just being there to help.
You just reported us all the way through. You're a member of the play. You are the play. The play is you.
So yeah. Good snapshot, I think.
Thank you, yeah. And I have to say, I saw just before the performance, Dr. Jen Zdarsky has been a huge champion of this project from the beginning, and she left a note on one of our feeds saying, like, oh, Caleb was so important at the Vagabond, I'm so glad that he's going to be there. So I think it's mutual, the feeling that everyone was a team there. Jetzel, I'm wondering if we could go to you for a moment, because I'm curious more about the intersection of domestic violence and homelessness and how you see that playing out in the system as it is right now.
So like I mentioned, domestic violence is one of the leading causes for women and children who are experiencing homelessness. And that can be seen in a variety of different ways. A power and abuse relationship or control that the harm doer has over the victim can lead to financial abuse, for example, and that can mean interfering with their employment. And if you interfere with their employment, there's no income, they can lose their housing because they can no longer afford to sustain themselves. The power and control can also mean survivors becoming dependent on their abusers. Isolation is one of those key factors that abusers will have over the survivor. And that isolation can lead to harmed relationships with their families and friends. Their support system that was once there might not want to support them anymore. And we often hear survivors saying, I don't want to ask my friend for help because they told me that if I stayed with my partner, they were going to kick me out, they were not going to help me. So survivors have the impossible option of choosing, do they stay with their abuser or do they risk becoming homeless? And if they have their children along with them, that creates an even more challenging decision that they have to make. So survivors are falling into homelessness as a result of their victimization. Like I mentioned, financial abuse can be a factor. There's the isolation, the power and control dynamic that exists over that abuser having over that survivor. It also can create, going a little bit back to the healthcare, they can have undiagnosed mental issues, they can have physical complications that can be harmful to keeping and sustaining housing. So often we're getting survivors who are on the street, and we also see it on the other side where survivors would rather stay on the street than go into a shelter because of bad experiences, out of fear that their abuser will find them, the lack of safety or confidentiality with the shelter. So it's supporting that survivor however best we can, because they know what's best.
Yeah, thank you. So I'm going to kind of ask Amber and Val a similar question here, because I want to know what's going on in neighborhood-specific areas. And I know that there are a lot of people who could speak to what's going on in San Pedro right now, but Amber, I'm wondering if you could start us off by talking a little bit about what in San Pedro is happening around housing and homelessness and healthcare. How do you see these systems playing out here that's specific, and where are maybe some neighborhood-specific barriers or things that that services are addressing right now?
I will try not to be a cynic. So one thing that really struck me about the performance that I wrote down, is something I say a lot, is like it's housing plus services plus compassion.
Yes.
And I find that in most areas, our area included, it's like where you're getting only two or one of those factors, but it's very rare to get all three. Either, and I would say not just under a service provider or region, but under one experience or interaction. And, you know, I think it was well exemplified in the performance that it's very frustrating. Like someone over here is offering services, but then there's no housing, or housing with no compassion, or services with no compassion, or services with no housing. And it feels, I won't cuss, but I like to cuss a lot. It's just a fucking nightmare.
Thank you.
I don't know how else to say it, but it is, right? And there are plenty of people here included that work every day in this. And one thing I'll actually speak highly of in our region is that we have, because we are the cul-de-sac of Los Angeles, as I said, we are a community, we're a neighborhood, we're like a small town in a big city, right? And so there's this sense of like, we work together to just get it done. And that might involve me saying like, hey, Reverend Amanda, we have someone that came into the Garden Church. She's gonna call Megan and get something. And we know that they go to Harbor Community Health Centers and they need dental work. So, you know, Dr. Lusk is gonna hook them up with that. And we know that once they're housed, it's gonna take $20 a month to keep them housed of just our community's money to get them groceries so that they don't fall into the donut hole of lack of services and become unhoused. And I have to say our community is really good about that. And, you know, I'll speak for myself, and I think a lot of folks, there's a lot of head nodding in the room of like, when it comes to that, we've established a network here to get that done so that we're not relying on the traditional service provision model, because there are gaps in it. There just are, right? We know that, you know, there's our, you know, local service provider will say like, well, we can't buy this thing for $18 for someone because it's not part of our funding stream and we won't get reimbursed. I totally get it. So we have Harbor Connect, we have an organization that literally goes in and gives micro grants for whatever someone needs to just get from point A to point B. And we have other, you know, non-traditional service providers like the Garden Church, who's like, come over for lunch on Sunday, or we know our 15 to 20 homeless individuals in this 4-block radius by first name, and they trust us. And that trust is just so important. And I think that's just the missing piece in the, another thing you all talked about is harnessing the power of empathy in a community to change this. Because I always say like our most untapped resource is all of us that are housed, right? So it's like we're funneling funding, we're trying to have service providers do this work where they don't make a living wage, most of them. And then there's this huge network of all of us who sit here and go, God, I wish I knew what to do. And there's gotta be a way to harness that, like in a more systemic way. I don't know the answer, by the way. of how to do it. But I mean, there are many answers, but I think one thing we've done well here, I'll say, is just connect generally so that we can brainstorm and solve for the things that our system doesn't cover. Is it a car seat? Is it a $16 pair of goggles so someone can get a job? Is it $4 groceries? Is it, I mean, I've given people cash that I know that are friends of mine that are unhoused where I allow, they can use whatever they need to use it for is their choice. So there's also a level of trust in that. That was a very long answer, but
No.
yeah, that's something we have here, I have to say. And it's imperfect, and I don't think it was here 5, 6, 7 years ago, honestly. There was an overwhelming feeling of like, our unhoused neighbors are not ours. They don't belong to us, they're not our people. And we have shifted that as a community.
Yeah,
So.
that's beautiful.
Yeah.
And it's really inspiring too. I mean, the performance talks about everything being under the same roof, and you're kind of painting this picture of a much bigger roof that's the whole neighborhood. Yeah. So Val, similar question for you. I know that Long Beach has its own services kind of, and it's its own thing very much. I will say I live in Long Beach, and it's kind of a mystery to me how it works sometimes. So if you would speak a little bit to what's happening in that city and how maybe it fits into the rest of LA County.
Okay, so yes, it is a very, a lot of the resources that the city has to offer are not connected. So the entry point for most of the services is the multi-service center. There are people who have been to the multi-service center and don't feel like they've ever been able to follow through the line. And I think, having a place that has, a lot of compassion and the services available even, because housing is very limited. Also, we run into the problem of, people who are unhoused, their livelihood and where they can stay each night changes all the time. People lose things, people get, during sweeps. And one of the main things, two of the main things you need are like a cell phone and an ID. And very often when people are, displaced from where they're living, they lose those items too. So people can't really get in touch with who they need to get in touch with to have that continuity of checking in, seeing where they are on a list. And then, it goes without saying that people become, frustrated and don't want to go that route anymore because they feel like they're not getting what they, need. So again, our program is not, we don't do anything forced, but we do offer people, transportation if they're willing to. We carry around supplies, emergency sleeping bags, snacks, water, hygiene kits. We do have ADA compliant vans so we can transport people in wheelchairs. Another problem that we run into, is families that aren't, the traditional family, who don't want to leave their partner to go to a place. The performance really highlighted, searching bags, people don't want their bags searched, which is understandable. And so we use what we can, a lot of community partnerships because it's not just them to see that we need. So, we have a list of people and organizations that are specifically, do one thing or another. And ultimately we just ask the people that we're interacting with what they need at that moment, what would help them the most. And we try to meet their needs exactly as they are, meet them where they're at. It's very important. And leave them better off than when we found them. We do get repeat calls, and that's another way of establishing trust. But we're not an outreach program, so we don't go back. We don't do a lot of follow-up. But just the way things are, we do get called out. We have a few people that we've met with a few times, and that helps establish trust because we come back and continue to build that relationship.
So I'm going to ask kind kind of two-part question, and this is for all of you, and then because I want to leave some time for the audience to ask questions here and to be part of the conversation as well. So this is my last question for you all, and it's kind of inspired by something that you said, Amber, around the idea that San Pedro was not necessarily like this 5 or 6 years ago. It does seem from the conversations that I've had with people and the interviews that I've watched with folks who are in the field right now from our COVID hotel project, that a lot is transforming and a lot is changing in this post the height of COVID period, right? And so my question for you all is, what do you see changing or transforming in the field right now? And then the second part of the question is, what do you hope will continue to transform? What transformations do you hope are on the horizon? And any one of you can start. I know it's like everybody probably needs a minute to think.
I think I want to talk about how siloed victim services have been. I know there's a lot of confidentiality within victim services providers, and we don't have shared databases, we don't have HMIS. All of information is confidential per agency. And I think one of the exciting projects that is coming up has been a centralized access line. Historically, survivors call multiple hotlines, tell their stories multiple times just to access an emergency bed. And when I used to work a crisis response team, we would call the shelters because we don't want, the survivor already told us the story. We don't want to have them repeat their story and potentially not find a bed after they've told their whole life story. So we're coming up with a centralized access hotline so that survivors are able to find temporary housing, permanent housing, any type of housing for them to just call one number and have to tell their story one time. So that will be a pilot project, I believe, launching at the end of this year or beginning of next. Currently, there's agencies that are piloting that program, have already submitted a start and see how we can take the community's feedback when they're working with survivors, but also survivors' feedback as to how can we better that system so that survivors are not calling multiple hotlines and are able to connect to services much faster, especially when they're fleeing abuse.
You know, we've had a lot of conversations in this project around harm reduction and trauma-informed care, and that feels like exactly what that
Yes, because it is traumatizing to enter a shelter. It's traumatizing to tell your story multiple times. And yes, it's not a trauma-informed process when survivors are calling multiple shelters. That should not be the way.
Yeah, it's beautiful. Thank you.
Yeah, I can try to go here. Yeah, I think from the healthcare lens in the clinic, I mean, it's changing the past 3 years for our little FQHC, but we're really bringing in great providers. So we got great providers, we got a really good group there right now, and we're expanding services. So it's something I'm hopeful about, and we're really trying to make a novel approach at treating addiction. It's just a part of primary care. So,
Should say that again.
addiction is part of primary care. Yeah, it's just a part of primary care. So,
T-shirt.
yeah. So we're trying to get a model where, you know, someone comes to the clinic, you don't know if they're there for an earache or for opioid use disorder. There's no judgment. You just come in. We have the resources to connect them to a case manager, and maybe we don't make too much progress on the first go around with the patient, and they show their next 3 appointments, but they had a good experience there, and we have better access. We have good providers where they can trust someone and come in, and then just low barrier access to evidence-based addiction care. There's long-acting injectable medications that can really help patients. not crave opioids, prevent opioid overdoses, and to give access to that in SPA 8 that where it's basically accepted by Medi-Cal is something new. So just having that in the Pedro area and then the Long Beach area too is a big change, and I'm really hopeful about it.
It's rare. It's great.
So I mentioned our program's new. We're in the first 2 years. We're still one team. No idea when or if we will be able to expand. There is hope, though, that we have more teams. But I think, you know, we are limited in the amount of harm reduction we can supply. We do carry naloxone and fentanyl test strips, xylazine test strips. But we do have the ability to like transfer people to community organizations that have, you know, more substance use, safe using supplies. And then I think just the fact that we have this new program, that we can go and meet people, and we don't call it alternative to police, but really it is, because we meet someone who is called the non-emergency line, asks perhaps for a police response, but if it doesn't fall under, we take a certain subset of calls, so mental health related, substance use related. There's a call code for unwelcome, which tends to be, you know, more often than not, it is an unhoused person or, you know, encampment. And it gives us the opportunity to like de-escalate. De-escalation is huge. And that's part of why we spend, you know, several hours at a time sometimes with somebody, because we want to give them time to, you know, ask for what they need. Because people aren't very comfortable with that sometimes because they've experienced, you know, poor responses in the past. And then, you know, just we have a 3-person team in the field. We all come from different backgrounds, and we have different, you know, lived experiences and professional experiences. So it's kind of like, you know, we meet people. Usually one of us has a better connection with whoever we're meeting, you know, and we allow that to happen organically, so that people don't feel like they're forced to talk to one person or not another person. And then I think another great thing about our team is that when we do get to, you know, where we are going with the person, like hospitals, people experience a lot of, you know, stigma and not the best treatment when entering the hospital. So we'll have our public health nurse go and go through security with them and help them get checked in. When we take people to the BUC, Behavioral Health Urgent Care Center, we sit with them and help them fill out the paperwork and wait for them to get called back. That can take several hours. You know, College Hospital, the same. St. Mary's, the same. We always want to make sure that people are going to get into where we drop them off, because we don't want to just be transplanting someone from one place to another.
And it sounds like it's very much one person at a time in that way, too.
It really is. It's one call at a time.
Yeah.
Sometimes we, you know, we're not homeless services, so we don't usually go to encampments with more people, but there are times that we go to sites where there are 6, 7 people, and we do the best we can. Usually trying to connect through our networks to homeless services, because sometimes that works better if it's, you know, one person on one team talking to another person on the team, finding the right person to come out.
I mean, it's important to take people as individuals in that way,
Yes.
too. Yeah.
As I was listening to all of this, I completely changed my answer. Because also I realized I have a very non-traditional role in this. Like coming from homeless services, where I worked with homeless individuals in the systems, and now in many ways I would consider my stakeholder is what would you guys call them, normies?
Yeah.
Like that's actually my patient population, if this makes sense. Because I realize that I pass as one of those. But I realize that the translating of this is like my role now. It used to be working directly with folks or working with service providers or helping build the capacity of the organizations doing it. I still do that obviously a bit for work, but like my actual like role as an advocate is very strongly in like, there's our neighbors experiencing homelessness, there's our service providers, there's our systems, and then there's everyone else. And I feel like my job is to do that one-on-one, because it is freaking one-on-one, changing hearts and minds, so that we can empower this, the systems, the service providers, the people, but we have a very hard time doing that when this whole morass of humans that I believe are very good, don't know what to do and are scared and make decisions like voting and with their money and with their resources and time and compassion and capacity that are counter to what we're trying to do over here. So I do think it's like the one at a time, helping folks realize that they're actually part of it. And to be part of it, you have to be a little uncomfortable because everyone else in the equation is also pretty uncomfortable. And I don't say that in like a horrible way or anything. It's just like your desire to feel better about the situation and be as comfortable as possible in your bubble is undermining what we're doing. So like my kids and I have like our values thing at home, and one of them is share everything. Right? Share everything. Another one's stickers are fun. But, we're very very intellectual, as you can tell around our house. But I really, if I could like change one thing about our system, it would be to work with this group. Let's just keep calling it that, because that's the them. And just be like, can you please care deeply about someone outside your household? Or like play with that idea. Like, what if I was to care so deeply about Amanda, which I do care about Amanda a lot, but like that her stuff is just as important as my daughter's stuff. What I would make different choices. And I'm not perfect. I make stupid choices all the time, but I try to like think about it that way sometimes. It's like, how much more could I share comfortably or uncomfortably? So anyway, I know that's not like really, I'm trying to help you all by making all of them better. That's it. Like, so and that should be another T-shirt. You are the them. Okay, it's not them, it's you.
What's the LAPD line? Getting the real deal out to Normalville.
That's right.
Yeah.
I love
that's
that.
The word.
I'm with you. Let's get those normals out.
Yeah. So I'm going to open this up to the audience for questions. Yes, Tom.
Two of you have a background in Skid Row. So I'm curious, I'll give you a couple options. You could tell us the most positive, impactful lesson you learned that you can find you can apply in any setting. You could tell us the most negative thing you experienced. So as you go to another setting, you're saying, well, I know I definitely don't want to do that. Or you could give a positive and a negative. And this is based on the premise that Skid Row is unique.
It is very unique. So in terms of negative experiences, I feel like that column is much more full than the positive side. But I have used it to inform the way I approach my work. There aren't very many places that are comfortable for people to go live in. The options are limited. It's like you can leave all your stuff and enter this place that isn't comfortable. You're not going to have your stuff, and there are issues with it. And listening to the way some people communicate with people experiencing people unhoused in the Skid Row area is very tough. I was working in harm reduction at another organization for quite some time, but realizing the absolute need for bringing harm reduction to everybody, meet them where they're at. There are different areas of Skid Row with different needs. We literally brought When I worked in Skid Row, it was divided into different sections because the different sections have different needs because people are in a community with the people that they feel comfortable with. And so, you know, meeting people where they're at, I see a lot of people on the ground, out in outreach. I'd like to see more of it. There are, you know, great places like the Sidewalk Project that brings a lot of, you know, stuff to the community members. You know, I think the People Concerned does a really good job too. I was on the team that was doing the Every Woman House program. And the definition of every woman was, you know, it was broad. So it was non-binary, trans, and, you know, female born, assigned female at birth women, to get them into one of the hotels that they, you know, changed into a housing. And it was a new conversion for the place, so it was all new. There weren't holes in the walls. There weren't, you know, bugs and, you know, vermin, and it was comfortable, you know. And we did that in mass and had people sign their releases and get into the unit. It did take some time because it took some time to roll out, but I think it was done pretty well. Yeah, just, you know, watching how people interact with, you know, people who they don't have the same life experiences, but you can treat people with dignity and respect, you know, across the board. It's not that hard. So I think that's one of the positive things that I get out of it, for sure.
Similar, yeah. I think, so I worked at it's on Maple and 7th or near there. It's a sobering center. They converted that briefly to like a COVID hotel thing. But that was my first exposure to Skid Row. And it was eye-opening, but I think what I got out of it, a couple different things, positives. It unlocked compassion for me, and so I think this was the first time I just talking to people that, you know, walked in different shoes. And I had a pregnant patient. I think this hit really hard for me in the show. Pregnant patient at it was at a different site, but the Vagabond site. And the beautiful thing about that is we got to go and see the patients every day. You know, they're 14 days, 28 days, whatever whatever's indicated. Yeah. So get to go around, and there's a patient, used opioids, was 4 or 5 months pregnant. You know, it was really tough to kind of like, how are you using? Why are you using? Explain this to me. And I think that just unlocked my ability to just listen to her. And I had the time to do it. And I took that with me the rest of my career too. But yeah, that just unlocked it, and it was in that setting, you know. So I could just really connect and like just listen to why, and even though it didn't make sense, over time it made more sense because she explained it. Let's see, and another just cool thing, people get up and they get the crap beat out of them every day.
Yeah.
Skid Row, and it's just like even the workers there too. It's like you're up against all this bureaucracy, or up against everything. They show up the next day. They show up with a smile. They show up to do good, and there's so much sadness there, but there's also so much hope and just great things in Skid Row too. So it's just a crazy but beautiful place. So I don't know how else to explain it.
Yes. I'm trying to put together what we did and what you have said. And what I get away from this is that one-on-one. I'm working with caseworkers that have 100 clients, and I'm a difficult client. So nobody really wants to work with me because I'm going to be a lot of time. They can help 10 people out in the time that they're going to help me. And what I've noticed with most of the people that went through the COVID hotels, the nurses and the doctors, they got burnt out. And then when they tried to come back in, nobody wanted to work together. working together makes everything better. And I have a hard time with all the agencies I'm working with, Pat, with Wesley Health Center, with APLA. They don't want to work together. And you have to repeat your story because, like you said, there's no database that fits in there so that your story is told and people have access to repeat it. So it's easy. I was blaming and shaming the government. And I was just so mad because I had my own business for 23 years. I had my own house for 15 years. I employed 200 people. My husband of 30 years died. I had an insulin over attack and I got it. Basically went to life. But I applied for my SSI disability because paramedics were 1 minute away. And they denied me. Even though I'm a 36-year long-term survivor, shooting 4 shots of insulin a day, 2 shots of T20 a day. And I lost everything. And I was eating out of garbage cans for a year, being beaten so badly I lost my dignity, my pride, my shine. But what got me was working together with earth angels like you. And when we work together, things come to better. So now what I'm trying to get at is like, how do we and you and all the people at the theater company, LAPD, who's just lost their funding, so many great 501c are losing their funding right now. So what can we do to make this better? What can we do? What do you think the future is?
Radical acceptance.
Yes.
Like, it doesn't hurt to just accept.
Yes.
And it's so counter to who we are as humans, though, because it feels safer to be like, well, that makes me uncomfortable, or everything but that, or what, and it's just like,
You didn't listen to me, that's why you're in this place. That's what I would get all
right, right, and it's just what if? Let's just try that game for a moment. You know, like, what if we just radically accepted people?
No judgment.
I mean, I think it would change a lot of things. I mean, something we don't talk about enough is like, we have now enough services and housing, not enough for everyone, don't get me wrong, but if no one became homeless newly in LA County, we would solve it in 4 years. If we could stop the fire hose of people becoming unhoused or unhoused again. But that's our struggle, honestly.
And there's so much money in homelessness.
Yeah.
That there's so much corrupt. You know, LAHSA went down, SRO lost 29 buildings. It's like, so that's the corrupt. But what can we do to work together? What are you doing so that we can open up?
And I think part of that, honestly, is the compassion for everyone involved.
Yes.
Like, that I accept, you know, we're talking about different service providers, like, I want to hold up and accept what you're doing. I want to hold up and accept what you're doing. Like, there's this competition that this field has created. I mean, I feel like when I got into like homeless services before it was cool or whatever, you know, like it's its own industry now, and it's competitive, and there's ego, and there's not enough, and there's a scarcity mentality around serving essentially poverty. Like, it's the craziest thing if you think about it. So I don't know what the answer is. I just want us all to care a bit more and maybe just like,
That's a huge step.
like, get
It's a
radically
beginning.
accepting.
Well, everybody's saying good things, and I want to say thank you so much for everything that you do. I want to ask a question about supervisors. Anybody supervisor up there? Because okay, the thing about supervisors before the pandemic, they had people, nurses and doctors running around like crazy. So things changed in the pandemic. You couldn't tell me to go in one door when I need to go in 5 doors. It has changed rapidly at this time now. How to deal with mental health, how to deal with senior citizens, how to deal with mothers with children, how to deal with pregnant women that's on drugs, how to deal with men that has different personal outlooks on life that needs personal help. So things have changed. So have the supervisors changed with the change?
Yeah, I think the good ones do.
Yes.
The good ones do.
Yeah.
I think it's just about empowering your staff. I mean, empowering your staff, hiring the right people that's going to be equipped to do the work. They're mission driven, and then just empowering them to do their best every day and step up to the challenges, because you just mentioned a ton of challenges and how quickly things are changing, so we have to adapt as well. And I think just getting the right people in there is a big part of supervision.
Do you think there's an opportunity to train people? I remember a long time they have an apprentice program. And they would pay you to go to school to learn to do certain things because they might need a person in emergency or something like that.
There's actually a pilot program going on in LA right now.
Yes.
Where community colleges
Yep.
are piloting, 2 of them so far, hopefully all of them soon, let's put the pressure on, are piloting using our most, I'm gonna say OG homeless service workers, those that have been in the field for 30, 40 years, and they're teaching them. They're going through certification programs on actually how to become part of the homeless service provision industry, trained though by folks that have done it throughout the years, and not just like a quick onboarding video you do on YouTube. And there are 2 classes right now, and I know it's not going to be enough, but because they're piloting it, that are in their 2nd semester of it. And it is really cool to watch, because not only are the trainings being done by folks with deep lived experience, many who actually had lived experience as someone unhoused at some point, but the folks that are doing it opt into it. It's not like forced, Yeah. And so these are people that are saying, like, I want to become part of this solution, but I want to do it well. Yeah. And I'm really hoping that this turns into a scalable model, because what we need is pipeline at all levels. We need pipeline for caseworkers, we need pipeline for crisis workers, DV, we need like everything, So that's my sliver of hope. There's like 65 of them.
The care campus on Skid Row, they're offering jobs where they will train you and pay you to be an advocate, train you to actually be there and welcome people to come in. So I've seen a huge change, a huge shift of where we're learning that we need more people, we need to train them. So thank you for that.
I think we have time for one more. Did you?
Oh, sure, that's good. Dr. Lusk, you used a really nice word when you talked about your experience at the Vagabond being like, it was just really natural, and that I think that it reminds me of the things that we've heard from so many of the frontline staff who were in similar QI programs and had similar experiences, and I think, and it's a theme of the show that systems are by nature, bureaucracies are by nature, profit-driven hospitals are by nature dehumanizing and almost make it impossible for people who are well-meaning practitioners to have those natural human-to-human experiences. So I'm just curious, because I think also Amber mentioned something about like, how do we scale it? We don't know the answer. I guess that's my question. Is it possible to inject that kind of humanity within those big bureaucratic profit-driven hospitals, or is the answer just like building this parallel system that happens over here where neighbors help neighbors, as Amber was saying, it happens in San Pedro, people know each other and know who to call, and I guess the way it used to be more like that in Skid Row too, that there were, you knew who to call to get somebody in the space.
I mean, there's, the healthcare system's crazy. It's like someone will come in and they'll be unhoused and you want to sign them up for case management, and they'll say, we'll run the insurance, get this verification, oh, you don't qualify, you have Health Net instead of LA Care. And it's just crazy. It just doesn't work. The beautiful thing about Vagabond, it was just like
everybody worked together.
Everybody worked together. The red tape was cut out. It was just like, do it. We'll figure it out later. We'll make it work. We learned every day. We had a huddle after the shifts. What worked, what didn't. Everybody was in it together. And I think to answer your question, I mean, it's going to be hard to change healthcare because it's a giant. But the work that everybody's doing here, like, it may not feel like you're getting the result you want immediately. If we keep chipping away at it, I think things will change. I'm optimistic, but maybe they'll not you too.
I was just going to suggest maybe you could end with like, is there a first step?
Thank you.
Like, is there something small?
Yes.
to get the word out, to
Unite. Fight for
to
what's
let
right.
Normalville know what's going on.
My thing is always don't be afraid to talk about it.
Yes,
And
fear.
when you know, I think our first thing as humans is when someone says something that we don't agree with, we tend to think, well, let's not make them uncomfortable.
Shut down.
Right?
Mhm.
And there's a way to do it. We're not making anyone uncomfortable. You know, just reframe and just leave a little more room for curiosity. I don't, you know, like, I don't know if actually that person's on crack. Just, you know, or whatever.
Yeah,
It's just,
or whether
you know,
they are cracked.
or whatever. But like, you know, folks just, it's offhanded comments all the time that folks, I feel like, say all the time. And it's just challenging it in a respectful way, because if it's not respectful, they won't take it. They'll be defensive. So it's more just like, how do we surprise people? How do we help them reframe
Thank you.
things?
I appreciate you all so much for being here today and for all the work that you're doing, and all of you. Thank you.
Take
I'll
care.
give you so much.